Sintul district, situated 85 kilometers northeast of the Kathmandu Valley, is one of the least developed regions of Nepal. It has one of the highest infant mortality rates in the world. This ranking is principally due to extreme poverty and very limited access to health structures. In Nepal, 80% of women give birth on their own and usually do so without any medical assistance. Why? Because they lack financial resources, information, and access to care. In partnership with the Nepalese Ministry of Health and 2 local organizations, and supported by Planet Finance, Médecins du Monde France has developed an innovative program that combines reproductive health and microfinance in order to best address the population's needs. Women's groups were formed in the villages. Once a month, these women meet to manage their credits and savings and take the opportunity to talk about reproductive health issues. The concept developed by Médecins du Monde France is based on women's groups, the seeds of future co-ops. The co-ops have a legal status and can be self-supporting. They are managed by the women themselves. The money saved contributes to the acknowledgement of women's rights, and more particularly, their right to access health care. Once in possession of their own savings account, they can independently decide whether to go to a health center, unlike before. In the past, families made decisions concerning expenses, and spending money to give birth in a health center was not a priority. Today, more than a third of the population has access to microfinance, covering 4,500 households. The women's group's meetings also have an educational dimension. A Médecins du Monde France trained mediator leads discussions on reproductive health. She recalls, "At the beginning, the women, often mothers of 5 or 6 children, were not very receptive. But little by little, the groups have grown bigger and the women became very involved in the discussions. I showed them images and information concerning the risks involved in giving birth and specific care for newborns. They were very attentive." In the last 4 years, over 4,000 women have participated in the educational sessions on reproductive health. 1/3 of births took place in health facilities, and 50 healthcare staff were trained on basic obstetrics care and prevention of infections. For Médecins du Monde France, one of the priorities in the next couple of years is to transfer this program to the local authorities and partners. There is still much to be done, but this experience should make it possible to set up the program in other remote areas of the country.